I've had complex partial seizures for 24 years, and it's been difficult, and I've led a lot of people throughout my life who have told me that I could not accomplish something or could not do something. And doctors tell me that I wouldn't graduate high school, wouldn't graduate college. And I've just always felt that push to, I'm gonna do this. I'm not gonna let complex partial seizures control my life. That's why we didn't throw in the towel. That's why we decided to try Sabril, also known as vigabatrin. The Understanding Together program is a program where people who are looking to try Sabril can call in and talk to someone who's already taking the medication. Some people want to call in to find out how my personal experience was with Sabril, and some of them call in and have specific questions. And I just do my best to answer their questions and tell them my experience with Sabril.
Sabril can permanently damage the vision of anyone who takes it. The most noticeable loss is in the ability to see to the side when looking straight ahead, peripheral vision. If this happens, it will not get better. People who take Sabril do not lose all of their vision, but some people can have severe loss and may only be able to see things straight in front of them, sometimes called tunnel vision, and they may also have blurry vision. For these reasons, periodic vision tests are required. Sabril may also cause other side effects. Please listen to the important safety information, including boxed warning for risk of permanent vision loss, at the end of this video.
I'm very fortunate that Sabril has been effective in reducing my seizures. Although Christy and I are very concerned about my vision, we feel the benefit of Sabril outweighs the potential risk of vision loss. The Understanding Together program has helped me because it's helped me accept the fact that I have a seizure disorder, and it's helped me really express myself. Because when I talk to these people on the phone, I can feel a sense of fear in their voice sometimes. And it's been really rewarding for me, and hopefully it's been a big help to the people who are debating whether to try Sabril.
Talking to someone who's walked in your shoes can sometimes be very helpful. To enroll in the Understanding Together program, please call 844-220-5938, toll-free. To learn more about Sabril, visit www.sabril.net.
Sabril vigabatrin tablets for oral use. Sabril vigabatrin powder for oral solution. Use. Sabril is a prescription medicine used with other treatments in adults and children 10 years of age and older with refractory complex partial seizures, CPS, who have not responded well enough to several other treatments, and if the possible benefits outweigh the risk of vision loss. Sabril should not be the first medicine used to treat CPS. Sabril is a prescription medicine used in babies 1 month to 2 years old with infantile spasms, IS, if the possible benefits outweigh the possible risk of vision loss. Important safety information. Warning: vision loss. See medication guide and full prescribing information for complete information. In all people who take Sabril, you are at risk for vision loss with any amount of Sabril. Your risk of vision loss may be higher the more Sabril you take daily and the longer you take it. It is not possible for your healthcare provider to know when vision loss will happen. It could happen soon after starting Sabril or anytime during treatment. It may even happen after treatment has stopped. Because Sabril might cause vision loss, it is available to healthcare providers and patients only under a special program called the Support, Help, and Resources for Epilepsy, SHARE program. Your healthcare provider will explain the details of the SHARE program to you. Sabril can permanently damage the vision of anyone who takes it. The most noticeable loss is in the ability to see to the side when looking straight ahead, peripheral vision. If this happens, it will not get better. People who take Sabril do not lose all of their vision, but some people can have severe loss and may only be able to see things straight in front of them, sometimes called tunnel vision, and they may also have blurry vision. Tell your healthcare provider right away if you or your child might not be seeing as well as before starting Sabril, start to trip, bump into things, or are more clumsy than usual, are surprised by people or things coming in front of you that seem to come out of nowhere, or if your baby is acting differently than normal. These changes can mean that vision damage has occurred. Your healthcare provider will test your or your child's vision before or within 4 weeks after starting Sabril, and at least every 3 months during treatment until Sabril is stopped. Vision should also be tested about 3 to 6 months after Sabril is stopped. You or your child may not be able to be tested in certain situations. It is difficult to test vision in babies, but to the extent possible, all babies should have their vision tested. Your healthcare provider will determine if testing can be done. Regular vision testing is important because damage can happen before any changes are noticed. Vision tests cannot prevent the vision damage that can happen with Sabril, but they do allow Sabril to be stopped if vision has gotten worse, which usually will lessen further damage. Even these regular vision tests may not show vision damage before it is serious and permanent. Parents, caregivers, and healthcare providers may not recognize the symptoms or find vision loss in babies until it is severe. If vision tests are not done regularly, your healthcare provider may stop prescribing Sabril for you or your child. Some people are not able to complete vision testing. If vision testing cannot be done, your healthcare provider may continue prescribing Sabril, but will not be able to watch for any vision loss. Brain pictures taken by magnetic resonance imaging, MRI, show changes in some babies after they are given Sabril. It is not known if these changes are harmful. Like other anti-epileptic drugs, Sabril may cause suicidal thoughts and actions in some people. Call a healthcare provider right away if you or your child have any symptoms, especially sudden changes in mood, behaviors, thoughts, or feelings, and especially if they are new, worse, or worry you. Do not stop Sabril without first talking to a healthcare provider. Stopping Sabril suddenly can cause seizures that will not stop. Sabril can cause serious side effects, such as low red blood cell counts, sleepiness and tiredness, nerve problems, weight gain, and swelling. Because Sabril causes sleepiness and tiredness, do not drive, operate machinery, or perform hazardous tasks unless it is decided that these things can be done safely. Sabril may make certain types of seizures worse. Tell your healthcare provider right away if seizures get worse. Before starting Sabril, tell your doctor about all of your or your child's medical conditions, including depression, mood problems, suicidal thoughts or behavior, any allergic reaction to Sabril, vision problems, kidney problems, low red blood cell counts, and any nervous or mental illness. Tell your doctor about all the medicines you or your child take. If you are breastfeeding or plan to breastfeed, Sabril can pass into breast milk and may harm your baby. If you are pregnant or plan to become pregnant, it is not known if Sabril will harm your unborn baby. You and your healthcare provider will have to decide if you should take Sabril while you are pregnant. The most common side effects of Sabril in adults include problems walking or feeling uncoordinated, feeling dizzy, shaking, tremor, joint pain, memory problems and not thinking clearly, eye problems like blurry vision, double vision, and eye movements that cannot be controlled. The most common side effects of Sabril in children 10 to 16 years of age include weight gain, upper respiratory tract infection, tiredness, and aggression. Also expect side effects like those seen in adults. The most common side effects of Sabril in babies include sleepiness. Some babies may have a harder time suckling and feeding or may be irritable, swelling in the bronchial tubes, bronchitis, ear infection, and irritability. Tell your healthcare provider if you or your child have any side effect that bothers you or that does not go away. These are not all of the possible side effects of Sabril. For more information, ask your healthcare provider or pharmacist. For more information, please see accompanying Sabril medication guide, full prescribing information including boxed warning, and instructions for use. Go to www.sabril.net or call toll-free 1-888-45-SHARE, 1-888-457-4273. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Sabril and Share are registered trademarks of Lundbeck.